Hi, it's Dominic on behalf of Live Health. I'm here with Dr. Voskuhl from the United States, California, the nice sunny bit. We're just going to ask a couple questions about pregnancy. The first one, I wanted to ask you, if somebody has just been diagnosed with MS, but they're trying to have a family, so they were doing that before and possibly even engaged in fertility treatment, what would you say to them?
I would say go for it. I think that's something to look forward to. I think that back in the really old days, people told MS patients you shouldn't have a baby. There's no merit to that. Actually, pregnancy can be very protective. It reduces relapse rates. There's some evidence that multiple pregnancies that you can have maybe even a benefit on disability accumulation. And actually, there is this issue, which is postpartum relapses, but that only happens in about 10 to 30%. It's actually representative of basically a group of women who have a lot of relapses pre-pregnancy. And again, even if it does happen postpartum, probably because you've gone off of your disease-modifying treatments, those can be resumed.
That was going to lead me on.
Yeah,
so I think a lot of people think,
yeah.
what do I don't want to give it, say, through breastfeeding, for example, or, what's the issues,
Yeah.
I don't want to give my child ocrelizumab.
Right. So the beauty of today is that we have so many MS treatments that are anti-inflammatory, and they really do prevent and treat relapses. So I think that it's a discussion that you would have with your neurologist and your GYN, primarily your MS neurologist, and talk about each treatment and what is your relapse propensity based on your pre-pregnancy rate, what is your likelihood to have relapse postpartum, and what would be the timing of discontinuation or resuming that treatment, and how would that fit with your desire to have breastfeeding. And so each drug needs to be reviewed, the one that you're on and maybe other possibilities to basically make it to where you're not on treatment as much as possible, but you can still enjoy breastfeeding and doing the things you want to do with bonding. But there's no problem with MS patients getting pregnant. That they have normal deliveries, and so this is a management to prevent a relapse that you may or may not have. We'll be ready if you do, but I wouldn't make it more than that.
If the guy's got MS prior to getting his wife pregnant, is there going to be any issues with things like sperm motility or disability or passing it on, hereditary? I mean, essentially, it might come from my side as well.
That's a good question, but the answer is no, that MS does not have an effect on fertility, either in the women or in the men. It could, so that's a good question. You'd have to look at the different treatments. There's new treatments coming out every day about do they affect fertility, but so far that I know of, I don't know of any that do that. With respect to genetic predisposition, there's been a lot that's been shown about that. Identical twins are more likely to have MS. If one has it, the other one will, but there's a lot of that don't. And the point of the story is, after many, many years of like GWAS studies, genome-wide analysis of genetic backgrounds.
GWAS, somebody called it the other day.
Yeah, that's right.
Okay.
so it's genome-wide analysis. And so what they've done is they take really just thousands and thousands of MS patients, and they do linkage analysis to see what genes predispose to getting MS or not. And as it turns out, that it's really up to hundreds of genes. Some are coming from the mother's side, some are coming from the father's side. So it's not like this disease where, you get one from the father, one from the mother. It's a 50-50 chance. Not at all. Right. So MS usually affects it depends on where you live in the world, of course, and latitude, but by and large, it's about 1 out of 1,000, 1 or 2 out of 1,000. But then if you have a first degree relative with MS, it'll increase to maybe 1 out of 100 or 1 out of 200. So still, I mean, the probability is low.
There's bigger risks in life.
Of course.
Yeah.
I mean, you could have a car accident or a lot of things that could happen to you.
I used to ride a motorcycle. That was my number one.
Well, that's fine. We don't talk about the numbers on that. So
yeah.
I say, great. I think don't. I think pregnancy and child. Having a child is one of the best things in life, and why take away something from someone who has MS? They have to deal with other issues, but that's not one of them. They should go for it and have a wonderful life and enjoy those kids.
So if I was going to distill your advice, go forth and multiply.
Absolutely.
Excellent.
Absolutely.
I really appreciate your time. Thank you so much. Lived Health will be bringing you on-the-day highlights from Europe's biggest annual MS conference, ECTRIMS 2022. Make sure you're subscribed so that you don't miss out on the latest updates in MS treatment from across the globe.